India is an agricultural nation. For the majority of India's population living in rural India, agriculture and animal husbandry are the main sources of livelihood. Farm animals also play a significant role in raising the living standards of the average Indian farmer by contributing to his income. To increase the productivity of farm animals, it is crucial to pay special attention to the upkeep and maintenance, health and nourishment of animals. That's why it's very important to identify diseases that affect animals and to find ways to prevent and to cure them.
To have maximum production from the animals, it is necessary that the animals are healthy, and then they can do more work, they can give more milk, they can produce, say in case of sheep, more wool or more eggs in case of poultry, and even more meat in meat animals. Now, for keeping the animals healthy, we should feed them properly with a balanced nutrition, and we should protect them from the diseases. So first, the control of disease is important. As soon as the animal is sick, we should report to the veterinary doctor and get the proper treatment. But there are infectious diseases which spread very fast, which are caused by viruses, bacteria and parasites. For some of these diseases, the vaccines are available. In fact, IVRI has produced about 45 vaccines and other diagnostic agents, reagents, and these are available against almost all important diseases of cattle, buffalo, sheep, goat, poultry, pig. If these vaccines they are used judiciously and in time as per the requirement, then not only the animals will be healthy, but their production can increase in proportion to the expenditure incurred on vaccination or on deworming from 4 to 8 times, and definitely it will benefit the production, productivity and income of the farmers.
Diseases affecting animals can be broadly categorized as infectious and non-infectious diseases. Viral infections such as foot and mouth disease are highly contagious and can spread rapidly from infected animals to healthy ones in a herd. The main symptoms include high fever, boils along the tongue, the gums, lips, nostrils and the joint of the mouth. Infected animals tend to froth at the mouth and are unable to chew the cud and lose appetite. They feel very thirsty and become weak. In a few days, they develop wounds on the legs, causing them to limp. If not treated in time, then the animal's hooves get infected, they develop pneumonia, gastroenteritis and pus-filled wounds. The animal can remain infected from anywhere between 15 to 30 days.
One of the biggest problems with this particular disease is that it spreads very fast. The farmers will have to be careful in detecting the symptoms of the foot-and-mouth disease, and as soon as a farmer detects foot-and-mouth disease in any of his animal, he should first of all immediately contact the local veterinary officer in the veterinary aid center or in the district level veterinary officer and take proper precautions. In the precaution, first of all, he should separate the infected animal from his rest of the animals and make sure that this animal doesn't get in touch with other healthy animals, because the disease spreads not only in contact with the infected animal, but it also gets spread by contaminated feed and the water. If an infected animal is feeding along with the other healthy animals, naturally the disease will spread very fast. Secondly, also the disease can spread through air, which of course a farmer cannot stop, but it is better to confine the animal in a closed place and to make sure that this animal is not coming in touch with the other healthy animals.
Cattle owners must ensure that preventive shots developed by the Indian Veterinary Research Institute are given to the animals at periodic intervals to protect them from disease. These medicines are widely available. Aluminium hydroxide gel injections, polyvalent inactivated cell culture gel, and oil foot and mouth shots are available. These injections should be administered by qualified practitioners.
The Government of India, for the protection of the animals, has launched a vaccination campaign in certain areas of the country where they are providing 100% vaccination to all the animals, and wherever these areas are, the farmers should take advantage of this. Besides this also, each state government has their own policy of vaccinating animals. Even the farmers who can afford, they should vaccinate their animals on time to prevent their animals from getting this infection. And also the Indian Council of Agricultural Research has got a project directorate which has network in almost all the states, and in which the good laboratories are there for giving diagnosis of foot-and-mouth disease. A farmer, as soon as he suspects, he should get in touch with the veterinary officer, and he should invite the veterinary officer to come and visit his animal and collect appropriate material for passing on to the laboratory for a confirmative diagnosis, and then take appropriate measures for protection by vaccination.
Another disease large farm animals are prone to is called hemorrhagic septicemia, or HS. HS mostly infects cattle and buffaloes, but can also be found in goats, sheep, and boars. The disease is also prevalent among calves since they tend to graze in moist areas. Domestic animals get infected mainly through polluted air or water, or even through physical contact with infected animals. The disease can spread rapidly amongst animals herded together in one place. The symptoms include internal bleeding and pneumonia. The animal also has trouble breathing and can run temperatures as high as 104 to 106 degrees Fahrenheit. The animal is not interested in feeding and milk production declines. The throat, neck, and joints of the animal also appear swollen. It is important to use both preventive and curative treatment for HS. The treatments include HS alum precipitated vaccine and HS oil adjuvant vaccine.
For this hemorrhagic septicemia, Government of India has launched a network program on hemorrhagic septicemia, in which 7 centers has been created in 7 state departments, and the mandate of this department has been given to identify the endemic areas and to develop the immunodiagnostic test and to refine the vaccine of hemorrhagic septicemia.
It is imperative to keep the living space of animals neat and clean, give them clean drinking water and a nourishing diet. Moisture and dampness should be avoided in cattle sheds, and there should be adequate ventilation. Regular vaccination combined with other preventive steps can go a long way in protecting animals from devastating diseases. To optimize milk and meat production, it is as important to look after small animals as much as large ones. PPR, for instance, is one such disease that affects smaller animals like goats and sheep. Known as goat plague or goat epidemic, it is a viral disease and is generally spread to healthy animals from the infected population. The disease is generally spread between animals by direct contact and through contact with virus-infected oral, nasal, ocular discharges and fecal matter. Farmers can recognize the presence of PPR amongst its flock through the following symptoms. The goats have high temperature and animals stop feeding. The affected animal shows thin and watery discharges from the eyes and nose. The discharges become thick, tenacious and crusty after a while. The goats show difficulty in breathing and respiration, and some goats show symptoms of diarrhea. Affected goats show increased mortality, and nearby healthy animals also are at risk of being infected. Affected goats also show oral ulceration.
PPR is very easy to diagnose because the symptoms itself will help a farmer to identify PPR. As soon as a farmer identifies PPR in its herd or in any of its animal, the farmer should immediately contact the local veterinary officer, the veterinary aid center, and of course arrange for vaccination for the rest of the remaining flocks and also the animals which are in nearby villages. The vaccine, IVRI has developed a vaccine also, and the vaccines are available. The farmers are encouraged to vaccinate their animals even before the disease comes to their flock. It is one disease which is preventable by vaccination.
Vaccination protects our animals from devastating diseases such as PPR. They can be administered to animals after 6 months of age. The entire village must ensure that all goats and sheep are vaccinated. If some animals are left out, then they can pose a major risk if affected by PPR. The disease could spread to other animals in the village. Poultry farming is a viable occupation for our farmers and for self-employed youth. But one disease that has proved devastating for the poultry industry is the Ranikhet disease, also known as RD. This is a highly infectious viral disease which affects all age groups of birds. Sometimes it results in the complete liquidation of poultry flocks. RD is found in poultry flocks affected by low immunity or when birds are not properly vaccinated against RD at the proper age. Affected birds show difficulty in breathing with symptoms of prostration, paralysis and torticollis. The combs and wattles of affected birds are shrunken, pale and discolored. Affected birds show a drop in egg production and loss of body weight. There may also be swelling of the head. Since RD is a viral disease, vaccination is an effective tool for its prevention and control. The vaccination schedule against RD is as follows. On the day of birth or between the 5th and the 7th day, 2 drops of RDF vaccine should be administered. 1 drop in the eye and 1 drop in the nose of the bird. The same schedule is to be repeated when the chick is 28 days old. Between the 8th and the 10th week, 0.5 ml injections of the RDR2B vaccine should be given either subcutaneously or as an intramuscular injection. Between the 18th and the 20th week, a 0.5 ml shot of the RD inactivated vaccine should be given in the form of an intramuscular injection. The vaccination against RD in case of commercial broilers reared up to 6 to 8 weeks is limited up to 2 initial RDF vaccines at the 1st and the 4th weeks of age. It is necessary to maintain biosecurity hygiene and sanitation in the farm along with the vaccination program. Always procure the RD vaccines from reputed manufacturers like IVRI, State Biological Products Institutes and other private agencies only. Make sure you use the vaccines before the expiry dates. To reconstitute freeze-dried live RD vaccines, only use chilled and sterile normal saline solution. Or else use a chilled diluent supplied by the manufacturers along with the vaccine. If there is an outbreak of the RD, then immediately vaccinate the affected flock with the RDF vaccine.
Disease like Ranikhet, which is a devastating disease, which creates the havoc in the poultry farms and causes heavy mortality. The IVRI has developed a very effective and suitable vaccine for this Ranikhet disease. Now, by use of this effective vaccine, the poultry farmers, all the poultry industry, they can get the maximum profit from their poultry industry.
Besides, while buying chicks, always ascertain whether the chicks in the hatchery are vaccinated in time. Please contact the scientists of the Indian Veterinary Research Institute or IVRI, Izzat Nagar, Bareilly, Uttar Pradesh to collect more information about the diseases of livestock and poultry. The scientists of this institute are always ready to extend all possible help to farmers.